Hi everyone, I'm Angeline from Selvi Mama SG. So for those who do not know, Selvi Mama SG is an e-commerce store focusing on baby and mommy essentials. So the reason why we are doing this today with Red Cross is because when I first started baby-led weaning for my girl when she was 6 months old, I had a lot of questions on what to do with baby chokes, and I myself was worried and nervous because there were really instances where she choked and I didn't know what to do. So I hope that this session will actually help to empower parents with the knowledge on what to do if baby chokes. So how to do this infant CPR, what to do if there's airway obstruction. So I hope this would really help. And for those who after this want to take up a course with Red Cross to learn CPR, I really highly encourage not just the child CPR but the adult CPR as well, because there's actually a lot of practical session which you'll learn only in class. And also just to share a personal story, my father back in August 2020, he suffered from a heart attack at home, and fortunately he survived because my mom managed to do CPR on him based on what she watched on TV. So it really helps if you actually respond calmly and as soon as possible. So with that, I will pass over to Miss Selvi here, our coach. She will be able to explain to you how to do it.
Thank you, Angeline. Okay, today I'm going to share 3 main topics for this section, mainly fever, febrile fits, and infant choking. So what are we supposed to do? So let's talk about fever first. So what is considered fever? Fever is usually the temperature above 38.5 or can be 38 above. It also depending what kind of thermometers you are using to get the accurate temperature for infant, especially baby below 1 year old. So there's a variety of thermometers around. So usually for babies, the accurate one will be the ear probe, where the temperature will be accurate using the ear probe. Or you can also use digital thermometer, but for babies we cannot put inside the mouth, it will be at the armpit. So what are we supposed to do if the baby got fever? If you notice the baby got fever, I think most of us will know how to treat fever, right? For adults, we know how to treat fever. But what about babies? Babies will not be telling you they got fever and all that. So it's the responsibility of the caregiver or the parents. When they identify the baby got fever, usually they'll be very red and also a bit of shivering. So this is where usually people will cover with blankets and all that, which you're not supposed to do. So what you need to do is this tepid sponging. Take a basin of water, lukewarm water or the tepid water, and then use a towel. And where are you supposed to do the sponging? Forehead, neck, armpit, and groin. These are the places where you can do your tepid sponging to reduce the fever. If the fever persists, and especially for babies, if the fever persists, please send them to the doctor. Seek medical attention. Probably the fever can be due to meningitis if the baby is below 3 months old. So that is for the fever. Next, I move on to febrile fits. So febrile fits, febrile means fever. So this time the fit is due to the fever. Usually happen to babies when the fever shoot up to 40 degree. And 40 degree, and if you never bring down the fever, it will affect the brain. And imagine the baby's brain are still developing, so you need to bring down the fever fast. So that's why you need to do sponging. But what happens as a caregiver or parents, we overlook on that. So once the fever shoot up, no time for you to do the sponging, and that's where the baby started to have convulsive movement, where the hand, leg all be very stiff and they be twitching. And you can see from the baby's face, they will turn bluish, the lips will turn bluish. Then you can see noisy breathing as they're having all the vomiters or saliva foaming around the mouth, and the stiffness of their body and the convulsive movement. So what you need to do is that when a baby having the fits, we can't do sponging already. We need to do our fits management. So the baby having fits, make sure the baby is not around any kind of sharp objects around them, because the hand will be twitching or the limbs will be twitching. So make sure there's no danger around the baby, and just let the baby have the fits. Let nature take its course. You cannot stop the fits and all that. So once the fit is over, then quickly turn the baby to a lateral position so that the vomiters or saliva will not choke on the airway. So this is what we can do. After that, have to bring the bring the baby to the pediatrician, or you can bring to the clinic or to the hospital. You can still do the sponging, but while the baby having the fits, you can still put the towel around the forehead and the neck on the body. So that is for the febrile fits. So let's move on. The next is infant choking. Okay, infant choking. This is a very common thing that can happen to the babies. So remember, babies is considered below 1 year old. So how you know a baby is choking? And what do they usually choke on? It's all on the milk. As a caregiver, parents, when you're feeding the baby, sometimes you never notice the baby can be choking if the baby's milk bottle, the hole is very big. So the whole milk will choke the airway. Another common one also, when the baby started to do weaning, when it's trying to give purees or like apple, they can be choked by that. If you never make the apple puree or smash the food properly. And the other one, if the baby started to crawl, this is where anything on the floor, it will end up in their mouth. So it can be a tiny item for you, but for them it's a big object which block the windpipe. So first, I'm going to show you how do you know the baby is conscious choking. Especially, let's say you're feeding the baby, and you notice the baby is struggling, fidgeting. This is already the first sign to show that the baby is choking already. What other thing to look up for? You also can look up for the baby will cry. Automatically they will cry. Tears will come, but there will be no noise at all. So loss of voice. What other thing? The skin, the face turning bluish. The lips all turning bluish or cyanosis. That tells you is lack of oxygen in the body. And also we hear a sound called stridor. The baby is trying to breathe very fast. Increase in breathing, that will cause stridor noise. So once you identify the baby is conscious choking, next what you need to do is that you need to do your back blow and chest thrust. It is not easy to carry the baby when they are struggling, but you need to do this, back blow and chest thrust. So how to do the back blow and chest thrust? Okay, so you see the baby is struggling. Put the baby on a firm surface. You need to sandwich the baby. So how to sandwich the baby? You pin down the baby, your 3 fingers and your thumb on the baby's cheekbone, not on the neck. You're going to strangle the baby since on the cheekbone. The other hand, try to slide underneath, straddle between the 2 legs, and then when you move away, switch over to your thigh. So your elbows locked in and your hand is resting on the thigh. So what is the next step? Okay, you need to do 5 back blow between the shoulder blade. So it's back blow, not rubbing the baby's skin. 1, 2, 3, 4, 5. Hold the baby's neck and the head together, sandwich again. Flip over to the other leg, tuck in the elbow, and you're going to do the 5 chest thrusts. So using your ring finger, draw imaginary intermammary line, 2 finger down. 1, 2, 3, 4, 5. Baby is still choking, still struggling. Continue back the 5 back blow, 5 chest thrusts. So hold back the baby and flip over, tuck in the elbow, then resting on your thigh area again, 5 back blow. 1, 2, 3, 4, 5. Then hold back the baby, straddle over and do the chest thrust. Again, draw imaginary line, 2 fingers down. 1, 2, 3, 4, 5. You notice something coming out from the mouth. So you need to hold the baby again and put on a firm surface. Put on the firm surface. Okay, with the sandwich technique. So now what you need to do is that gently tilt the head. Head tilt gently, gently. Don't hyperextend the baby's neck. If not, you're going to break the baby's spine and the neck. Open the mouth. If you see something, use your pinky finger because baby mouth is very small, and then take it out. So once the baby started to cry, it's a good news. You can carry the baby. But if the baby is still struggling, again the baby is still choking, you need to continue back your back blow and chest thrust. So a lot of parents may have this thinking, my baby is so heavy, can I stand and do or not? The back blow and chest thrust. If your baby is very big size, you're not able to handle the baby while in the standing position, you can still sit in a chair. You can still do your back blow and chest thrust. Sometimes when the learners have this question, so can I, let's say got no chair there, can I kneel down and do? You can kneel down and do. The probability is that the head will be hitting the floor if you kneel down and do. So it's best to get a chair. Mostly when you're feeding time around, there'll be chair around there when you're doing feeding to your babies and all to the children. So you can sit down and do your back blow and chest thrust.
If baby is above 1 year old, we don't do the 2 fingers anymore. We do the adult CPR. So for more on that, maybe you can look at some videos or come and take some classes.
Okay, so as what I say, babies are from newborn to below 1 year old. So if it's above 1 year old, then you can do as what we do for children and adult is your abdominal choking. So there are other techniques to do. But now in this session, I'm focusing more on the babies, infants, because they are more prone to the choking.
During the class, somebody asked whether we can use the thumb to do, because it's actually more kind of not so straining. So
okay, using the thumb, yes, because if you cannot find the landmark properly, using your thumb, you can break the breastbone of the baby. Baby's breastbone is very short. Okay, I think there's another question from the audience. What happens if the baby turns unconscious? Good question. So, in real life, when you're doing your back blow and chest thrust, the foot should come out ready. But let's say they turn unconscious, probably your techniques is not good enough. So what you can do is that once the baby turns unconscious, place the baby on a firm surface. So once the baby is unconscious already, put on a firm surface. Now it's unconscious, so you need a professional help ready. So you need to ask somebody to call 995 for SCDF and get the AED if there's need to. So now the baby is unconscious, gently do a head tilt chin lift, do not hyperextend. And what you're going to do? Now you're going to do your 30 chest compression. So using your index finger, draw intermammary line and 2 fingers down. So you're going to do your 30 chest compression. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1 and 2 and 3 and 4 and 15. 1 and 2 and 3 and 4 and 20. 1 and 2 and 3 and 4 and 25. 1 and 2 and 3 and 4 and 30. Remember the depth you're doing is about 3 to 4 cm depth. So after 30 compression, gently head tilt chin lift, open the baby's mouth. Then if you see something is there, use your pinky finger to sweep off the foreign object. But if still nothing is inside the mouth, do not perform blind sweeping. Continue back with your 30 chest compression, because the foot can still be in the windpipe. So we do the 30 chest compression, open the airway, open the mouth. If you see something inside, then finger sweep. After you finger sweep, you need to make sure whether the windpipe is blocked or the airway is still patent. You need to do your puff, ventilation. For babies, we cannot pinch their nose because it's very soft. So what you need to do is that open your mouth big enough to cover the baby's nose and mouth together. And we are only giving 30 mils of air. So puff. First puff, chest did not rise. So don't confirm it's still choking. Probably you never do your head tilt chin lift properly. The tongue still falls back. So you reposition the head. Then give your second puff. This time the chest rises. That means good news, the airway is clear. Then you check the baby's breathing. Look at the rise and fall of the chest. You notice the baby is breathing. So that means the baby is unconscious but still breathing. So what you can do is that if you want to carry the baby, you can carry the baby. So how to carry the baby? In the lateral position first, hold, support the neck and the waist and turn the baby to the lateral position. So if you want to carry, you put your hand underneath and then support the head and it's tilted down. Why is it in this position? So whatever is choking the baby, the milk curds or fluids will just drain out. It will not block the airway. So this is what you can do if the baby turns unconscious. Okay, good. We have another question. Can we use AED? Okay, it's a good question. So for baby, it's not necessary to use AED. They don't have cardiac arrest cases and the chances are very low they can go into ventricular fibrillation. So AED is more applicable for 1 year and above. So you can use on the child and adult, for sure you need the AED. So if you're going to use on the child, so we still can use the adult AED pad. Since most of the AED around in Singapore may not have pediatric pad. So we can still use the adult pad. So placed on the below the right collarbone and the left of the left nipple. So but if the child is too small, very petite size, you must make sure the AED pad is 1 to 2 cm apart. So if the child is very small size, you cannot paste together like this. So what you're going to do, the one below the right collarbone will go in between the back, between the shoulder at the back. And the one at the left of the left nipple will go to the front portion. So that is more in the children. So for babies, it is not necessary to use AED if you're not comfortable to use it. But what I say just now, call 995 SCDF, get AED, is medical people around, nurses, doctors around, probably they will help to use the AED on the babies. So for as a lay first aiders, it's not necessary to use AED on the babies.
So I think maybe one question that I also had was about fever. So I've got a lot of parents, and also because of COVID, right, a lot of babies actually have fever, 39 degrees, they panic and then we send to the hospital. So when do we send a child to the hospital if they have fever?
Okay, usually I already told you just now the babies when they got fever is like 38.5, higher than that. And COVID time, of course, a lot of people falling sick and all that. So for baby, no need to rush them to the hospital first. Remember our tepid sponging. We try to bring down the fever first during a tepid sponging. At the same time, you can give whatever prescribed medication given by the doctor, by your pediatrician. So you continue with the medication. And you can still bring to the pediatrician, no worry to go to the hospital straight away. You can go to your family doctor first.
So, but if it's 40 degrees and above, should we just immediately send, or if they start vomiting?
40 degrees and above and your tepid sponging still cannot bring down the fever, quickly send them to the hospital. And if they show other signs and symptoms like vomiting, the feeding is not very good, they refuse to drink the milk or eat the food or whatever, quickly send them to the hospital. Because probably they'll be dehydrated. Okay, just to summarize what Angelina you asked just now about the fever and the febrile fits, it can go together, but not every baby may have febrile fits. So at the fever stage, if you're able to control the fever on time, doing the sponging, giving the prescribed medications and all that, you can bring down the fever. But sometimes due to negligence of the caregiver or the parents, sometimes they never bring down the fever on time, that's where it will lead to febrile fits.
And that's dangerous, right?
That is dangerous. Because remember, the baby's brain is still very small. It's still growing, developing. So if the fever going to shoot up so high, next time, if the baby keep on having febrile fits, next time their thinking capability is very slow. So as a parents or caregivers, when the baby is having fever, try to bring down the fever as far as possible. Don't wait until it go to the febrile fits. And once the baby go into febrile fits, we can't do anything much. No point going sponging them because they're already having the fits. I mentioned, don't put anything obstructing the baby having the body stiffness and the jerking. Let the baby have the fits first. And another one more thing, people like to do this. I don't know, Angeline, you come across or not. They put spoon inside the mouth. So they also do for babies also. They think they are biting the tongue.
Oh no.
So please do not put. Or some parents will do what? Put their finger inside the baby's mouth because they're scared the baby is biting the tongue.
Oh no.
So the baby is not biting the tongue. Don't worry too much on that. Remember, they're unconscious. The tongue already fall at the back of the throat.
Right.
So what they're biting is just the membrane only, the mouth.
Okay.
So please do not put anything, especially the finger. I know it's your baby, so don't put your fingers all inside the mouth. Okay. Another one more thing also, do not restrain. Don't hold the hand, hold the leg when the baby having the fits. Let the baby have his fits. Okay. Then after that, quickly bring to the hospital.
Okay. So I think my baby girl, she had fever around 14 months or so, and then she was at 39 degrees. So fortunately, she didn't have any febrile fits. But when we fed her medicine, she actually puked.
Oh, okay.
But then we managed to we continued feeding her again, and then after
puke.
We let her rest and then we feed her again. Then managed to, because if not, then her fever will not be able to go down.
Yes, true.
So it was like quite a stressful period, but I think it's quite common, right?
It's common, yes.
Because even I taste the medicine, I feel like puking.
Even adult also will not able to take medication, right? So what about babies?
Right.
So usually they will puke it up, they vomit up the medications and all that. Okay, let's see. I think we have a question from the audience.
Oh, great.
So what to do if the baby has allergy, reaction to certain food, when to bring to hospital?
That's a good question.
It's a good question. Because nowadays when you're talking about allergies, it doesn't happen to just babies, any age group, can be even elderly people. So when talking about babies you need to confirm what they're allergic to, because sometimes certain substances may not be, the body cannot will react to the substances and all that. So you need to monitor the baby, what is he allergic to. If you're talking about food substances, take note, if every time you give these food substances is allergic, then probably you can't give this. Or if it's allergic, you got rashes on the body when touched by certain substances. So you need to monitor that. Even you bring to the hospital, the doctors is still going to ask you, what is it, what's the substances or what is the food is allergic to. So as a parent or caregiver, you need to keep track, at least for a few episodes.
So for me, I did 100 foods for my baby before she's 1 year old. So what I did is I actually keep a lot of the foods that she eats. So every new food that she eats, I have a lot of everything that she eats. And for allergens, I actually take note like the major allergens. So if let's say I'm introducing prawn or wheat, I make sure that I introduce early in the day, like maybe in the morning or in the afternoon. So I have actually time to monitor if she has any reaction to the food. And if there is any reaction, the first thing I will do is stop giving the food. And then you monitor how severe the reaction is, because sometimes it's just rashes, and then once you stop, you will just go away. And then it's not to say that you don't give the food anymore. Maybe you just try like maybe 1 week later or 1 month later, just to see whether the reaction is still ongoing, because sometimes their digestive system is not developed yet. So fortunately, so just keep a lot of foods, and then if you are introducing an allergen, make sure you do it early in the day, and over 3 days you repeat that same allergen. So you know that, oh, okay, there is an allergy to this particular food, and you just monitor and be careful. If the reaction is really bad, like really bad rashes and cannot breathe, or like very severe reaction to that particular food, stop giving until advised otherwise by your doctors.
Yes, true, Angeline. So that's why you need to keep track. What are you feeding to your babies? That'll be easier for the doctor to diagnose also, whether they've got allergies.
So maybe really have to just keep an Excel log. I have a Excel file on that. I mean, you can reach out to me. I can send it to you.
Okay. Okay. We got another question. How hard to do back blow? Good question. How hard to do back blow? Okay. So far in the theory wise, they did not mention how hard, but you just have to do hard enough. But after the food comes out, the baby become crying and all that, just bring the baby to a pediatrician or to your family doctor just for a checkup. Because the blow you're doing, I think Angelina just now you practice, right? The blow you're doing can be hard enough also.
But actually maybe it don't need to be so hard until it's painful for the baby, right?
Baby won't feel painful now. Baby, remember, cannot even cry. Even crying also no sound.
True.
So you have to do hard enough but
force.
Not that forceful. I mean, especially if your guys got very big palm, don't do so hard on the baby's back. So it's all, I cannot say how hard to do, but it's just forceful enough for the food to come out. Good question. Where do we take temperature for baby? Is it forehead more accurate or armpit more? Okay, just now when you're talking about fever, I told you there's various methods to take, and also depending on what thermometers you're using. So Angeline, what thermometer you use for your baby?
I use the
infrared.
Yeah, the infrared one. So I actually do forehead.
Okay, so infrared, I wouldn't say that it's so accurate. Because if the baby having like sweat or whatever, it may not capture the actual temperature. So I did mention just now is the ear probe. Using the ear probe is more efficient, and the temperature is really reliable.
How about armpit? Because I read somewhere that armpit is the most reliable.
Armpit, that is the part for baby very chubby, a lot of muscle there. What happened? Too much, yes, too much of fats there. So sometimes it be warm.
Oh, right.
It be warm also. So again, it's not so reliable and all that. It's warm and all that. So unless you clean up the baby, then maybe you clean the baby now, it's not so hot. Then you can take the temperature at the armpit. If you ask me, more reliable one is the ear one.
Same as the adult.
Adult we can take oral, but provided you never drink hot drinks and all that. For baby, we can't take oral. They can't be holding the thermometer, digital thermometer. Yes.
How much strength to use in CPR for a 2-year-old child? Adult technique, but strength should be less.
Okay, good. So the technique for CPR for adult and child is the same thing. So above 1 year old, we consider child already. So their depth will be 4 to 5 cm. 4 to 5 cm using your both hand interlock and placing on the lower half of the breastbone. So it's 4 to 5 cm. For adult, it's 4 to 6 cm. So there's not much of difference.
But the force, like the
it's still
strength,
4 to 5 cm. So it's 1/3 of the chest wall. 1/3. But the rate of compression is still the same. 100 to 120 per minute. When you do your counting, it's all the same. Yes. The depth is 4 to 5. But if you think the child is very petite, then maybe you can do 3 to 4. So it's all depending on the child body size, whether they're petite. Because long time ago, we only use one hand for for child CPR. Only one hand. But as time goes on, when they do research and all that by the Resuscitation Council and all that, then they say that now we need to do harder, 4 to 5 cm. Because the size of the children nowadays, even though can be 2 years, but they look like 4 or 5 years. Okay, so that's a good question. Do fever, relief, balms, etc. really help in reducing temperature? So when talking about all these balms and all these things, but as a first aider, when you're doing your first aid, we are just talking about doing your tepid sponging. So we don't rely on all these medication and all that which is going to apply on the baby's skin. Probably the baby's skin may not be able to take it. It may show signs of rashes, itchiness and all that. So we do not apply anything on the baby skin, unless you're really sure, you already applied before, like Zamba and all that. Sometimes they apply on the babies and children.
I actually put the the cool patch on the
Fever cool.
Is that okay? Or
Does it work?
I don't know. I just put because
just now when I talk about fever, I told the pressure points: forehead, neck, armpit, groin. These are the pressure points in the body. So this is where you need to cool down because of blood vessels and all that. So if you just use your fever cool, the pad on the forehead, it's not good enough.
Alright, so we should just take like ice towel.
No ice, no ice.
Cold.
Tap it water. Just tap water.
Oh, okay.
Tap water, towel, and do your sponging. We do not use ice water on the baby. Ice water, the temperature too drastic for the baby.
Oh, okay.
So ice water is too drastic, so we do not use ice water on baby.
Right.
So just use your tap water, is good enough, the temperature.
Okay. So I think that answers the question on fever relief balms and the cool patch. I used that too. I didn't know.
So just to summarize today's section. So today I talk about fever, febrile fits, and also infant conscious choking. So as a caregiver and parents, these are the main thing you're going to look at in your baby, especially fever. Don't make the fever go so high until it's going to affect the baby's brain and all that, which will lead to febrile fits. And also choking is another main thing, especially when you're feeding time the baby, concentrate. Because there's a lot of articles that happen, which I read a few years ago, or when I come across such incident, is due to negligence the baby have to pass on, just because of choking.
Yeah, and so choking is not just from food. It can be like when you're a baby, it can be 2 months old baby, you're just drinking milk, and then they choke on the milk because I'm now. So you really have to burp baby. It's not really you just have to do it, but it's really because it can cause choking if you don't burp the baby. Like the milk can all come out and cause choking. So it's not just solids. Like even as a like very young infant, we also have to take note.
Yeah, of course, Angeline. When talking about feeding baby, remember baby depend on you. Few months old, 2-3 months old. So if you're not going to burp the baby, you're going to put that, you're going to aspirate, then you'll get choked. So who's causing the choking is not baby himself, it's parents and the caregiver. Unless the baby started to crawl, then again the environment.
Like no small
items and all this.
Yeah, because they put everything in their mouth. Like they can put coins in the mouth and then they choke on the item and they can't talk. And I mean, if you are not watching your baby, it might be too late. So just make sure that you keep the environment really safe.
Okay, I hope that today's section was useful.
Yeah. So any other questions, just feel free to drop Red Cross a note, or like can drop me a note, I can try and answer them. And we will be putting this video online and also doing a blog post. And if you need more information, you can sign up for the course. Ms. Selvi here is great. She will explain everything you need to know, and you'll be more confident as to what to do if something really happens.
Okay, yeah, thanks Angeline. We also have this basic child infant first aid course. It's a 1-day program which will also include common medical conditions a baby or the child will have, and also all the choking, CPR, how to do on the baby and how to do on the child. So if you want to know more information, you can go to our redcross.sg website. You can see more information on that.
If there's no more questions, then we will end the session. Thank you, everybody. Thanks for joining us.
Thanks for joining us.